Hi, can you tell me your name?
Sarah,
And around what time is it?
9 p.m.
And where are you at?
The hospital.
Perfect. And starting at 0, can you count up by 7s and I'll tell you when to stop?
7, 14, 21, 22.
Perfect. So now I'm looking at the skin, looking for any redness, any lesions, any wounds, any cuts, anything like that. Can I see your nails? Now I'm looking at the hair, just going to palpate the scalp. Looking at the hair distribution throughout her whole body. Making sure it's even in the colors, about the color of the hair is about the same in all the areas. Now looking at the face, looking for the symmetrical of the face. Just going to feel that on your face. Whenever you feel it, just let me know. You close your eyes.
Yes. 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 Yes.
Perfect. Can you smile for me? And frown. And puff out your cheeks. And make a face like you're going to whistle, but don't actually whistle. Perfect. And can you close your eyes? I'm going to try to push up on them. Don't let me open your eyes. Okay. Can you open and close your jaw? Perfect. And kind of pretend that you're chewing food. Just clench your lip. And one more time. Perfect. Excuse me. Now I'm looking at the nose. Looking for any deviation, any abnormalities of the nose. Now I'm looking at the ears. Looking for any drainage coming out of the ears, any redness, any pain or tenderness when I do this?
Nope.
Okay. Can you cover that ear? I'm gonna whisper a word. Just let me know what I say.
A, B, C, D.
Yes, do the other side.
X, Y, Z.
Perfect. Now I'm just gonna put this on top of your head. Just let me know if you can hear it equally in both ears or better on one side than the other.
Equally.
Perfect. Now I'm just gonna put it behind your ear. Just let me know when you can no longer hear it. I'm gonna move it to the front. Ready?
Mm-hmm. I can no longer hear it. I can no longer hear it.
Okay. I'm just gonna do it on the other side.
I can no longer hear it. I can no longer hear it.
Now I'm just looking at the mouth. First I'm gonna look at the lips. I'm gonna look for any cracking, any dryness, any abnormal redness of the lips, any cracking out the side. Can you smile for me? And can you open up your mouth? I'm also going to look at the teeth for any dental cavities, any lesions of the mouth, any redness noted inside the mouth, any bleeding. Can you stick out your tongue and say ah? Perfect. And can you stick out your tongue and move it side to side? And can you move it up and down? Good. Now I'm looking at the eyes. I'm looking at the eyebrows, the eyelashes, the sclera, the irises, the conjunctiva. Can you cover one eye and then read the bottom line? The lowest line you can see.
3, 7, 4, 2, 5, 6.
Perfect. Can you cover the other eye and read the lowest line you can see?
3, 7, 4, 2, 5, 6.
Perfect. And can you look straight ahead and just follow my finger with your eyes? Perfect. And can you cover your right eye? I want you to focus on the door, and then I'm going to bring my finger into view, and I want you to focus on that, okay?
Mm-hmm.
You ready?
Mm-hmm.
Okay. Do the other side. Do the same thing. Good. Can you cover that eye for me? And just let me know whenever you can see my fingers.
Yes.
Okay.
Yes. Yes.
All right, can you cover that eye and do it on the other side?
Yes. 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 Yes.
Okay, and can you cover that eye one more time?
Yes.
Okay. Now I'm just going to shine the pen light in your eye. Can you cover that eye for me? Okay, can you do the other eye? And you can uncover both of them. Does this hurt at all?
No.
Okay. Now I'm inspecting the neck. I'm looking for any jugular vein distension. Looking to make sure that there's not any tracheal deviation, anything like that. Okay. Now if you can just, I just want you to take a sip, but just hold it in your mouth. And I'll turn your head first this way, and then I'll ask you to swallow, okay?
Okay.
You ready? Turn your head that way. Perfect. And can you do it on the other side? Perfect. I'll take that. And then can you turn your head from side to side? And then I want you to turn your head again this way, but I'm going to push against it. Just don't let me do it, okay? Good. And the other side. Good. And can you shrug your shoulders? I'm going to try to push down as you're pushing up. Don't let me push down. Good. Okay. Now I'm looking at the rate of her breathing, looking for any abnormalities, looking for any, if she's breathing labored, looking at the AP diameter of the chest. I'm also looking to see if there's any retractions, if there's any use of any accessory muscles. Okay, can I have you turn your body this way for me? Just gonna bring your hair forward. Okay. I'm just gonna listen to your lungs. I just want you to take big deep breaths as I'm doing it, okay? Just gonna listen in the back. Now, bronchoscopy is done whenever, it's just whenever you listen to their lungs in general. Egophony is whenever you have them say E whenever you hear normal lung sounds. Can you say E for me?
E.
Okay. And then the whisper pectolari is whenever you whisper words to them and you put your hands on their back again and you feel for anything. Can you whisper A, B, C, D? Perfect. And just breathe. Take one deep breath. And one more. And then let me know if this hurts.
Nope.
And,
nope.
Okay. Alright, so now I'm looking at the precordial area. Looking for any palpitations, any bony prominences, anything like that. So the aortic valve is heard on the right second lateral sternum area. The pulmononic is heard on the left lateral sternum area. The herbs, which is also known as the second pulmononic, is heard on the third left lateral sternum area. And then the tricuspid is heard on the fourth left lateral sternum area. And then the mitral valve is heard on the fifth left midclavicular line. So I would have someone sit in the sitting or lateral position if I heard any abnormal heart sounds, like murmurs or anything like that. Then I'm just gonna have my patient lay on their back. I'm gonna have with one pillow under their head and then their hands by their sides, and they would have just emptied their bladder. I'm just gonna inspect the abdomen, looking for any scars, any lesions, looking at the umbilicus for any abnormalities there, noting any masses that I see. Let me know if this hurts anywhere.
No. 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 No.
Okay. Let me know if this hurts anywhere.
Yep.
I'm gonna go a little deeper. Okay. So I'm gonna have you take a big deep breath. I'm gonna stick one hand under your back and the other one's gonna come right up here, okay?
Okay.
In and out. Okay. Let's do the other side one more time. Perfect. Okay. Can you bring this leg over that leg and out? And can you do the same with the other leg? Can you bring this foot up to this knee and then bend it outwards and bend it in? And can you do the same thing with the other leg? Inwards and out, yeah. And then can you bring this leg up to your chest and do it with the other one? Good. And can you point your feet up the wall and then point it towards you? Perfect. I'm going to try to push down on your feet. I want you to pull up and don't let me push down. Ready? Good. And push down. Good. And then can you raise your leg? I'm going to try to push down. Don't let me push down. Good. Do it with the other side. Good. And this time I want you to raise it and I'm going to push up. Don't let me push. You're going to push down. Don't let me push up. Let's do it with the other side. Good. Can you turn this ankle in and out? And can you do the same thing with that ankle? And can you wiggle your toes? Perfect. Okay, can you stand up for me? Can you bring your shoulders out and in and down and go out again and go back down? Perfect. And can you raise them up? I'm going to push down, don't let me. I'm going to pull up, don't let me. Good. And can you move your wrists like this? And move your fingers. Squeeze my fingers. Good. And do your elbows out and in. Okay. Keep your arms just like that. I'm going to try to push them towards you. I want you to push down. And same thing. Good. And then can you do this and behind? And can you touch your toes? And can you go Can you move your head up and down and side to side? Can you roll your neck? Roll your shoulders. Okay. You can have a seat. So the S1 sound is heard at the closing of the tricuspid and the mitral valve, and the S2 sound is heard at the closing of the pulmonic and the aortic valve. And